for joining us today. We've got 6 fantastic speakers, which is great, but I'm just going to give you a quick overview introduction before we get. So my name's Lauren Winch, for those of you who don't know me, and I'm the manager of the Bristol Poverty Institute. And just a bit of housekeeping, as I said in the chat window, please mute the microphones if you haven't already, and make sure that you've added your name rather than just being listed as guest or so forth, just so we can assure all attendees are legitimate and genuine. Please also be reminded that we are recording this webinar and that by attending, you're consenting to being recorded. We're hoping to share it online after the event, subject to technical issues allowing us to do so. If you're not comfortable with that, then unfortunately we do ask that you need to leave the webinar because we can't exclude individuals from being recorded. It's too complicated, so I'm afraid we have to record everyone. So if you're not comfortable, then please leave now, but hopefully you will stay with us because we've got a great webinar ahead. So as I mentioned, my name's Lauren and I'll be chairing this seminar today. My colleague Sarah Blackmore will be taking minutes for a post-event report, which will be circulated to all of you, as well as anyone who was planning on attending but wasn't able to make it on the day. If you don't want your name to be included in that document, please do send me an email and we'll make sure that you're omitted from that. For those of you who aren't familiar with the Bristol Poverty Institute, or the BPI for short, we just wanted to provide you with a little background. So BPI was established in 2017 as one of the 7 specialist research commission of the university's strengths in poverty research, and is headed up by its director, Professor David Gordon, who is on the webinar today. The BPI was set up with the ambition of driving forward the university's research on causes, effects, and measurements of poverty in order to better inform policy and practice. And one of the key areas identified in the original business case for the Institute was to enhance interdisciplinary approaches to poverty. And this is why we originally set up this webinar series, which started a couple of years ago in person, with the aims of facilitating networking, experts and approaches, showcasing the range and value of research taking place on poverty-relevant themes across the and setting collaborations in motion. We've also opened it up to select external attendees who can add value and nuance to the discussion and to help identify areas of synergy and opportunities for collaboration beyond the university. Webinars and webinars now on a wide range of topics, from conflict to debt, and from digital inclusion to, well, exclusion, as the case quite often is for those in poverty, to issues such as environmental resilience and food security, all of which have strong and important poverty dimensions, and of course childhood obesity is no exception. So we're lucky to have 6 fantastic speakers today who are going to introduce us to different approaches on childhood obesity and how this can intersect with poverty. Those presentations will have an open discussion. So each of the speakers have 5 minutes, and that will be strictly timed to make sure we've got enough time for that open discussion. I do have a sign I will hold up, and that's the aim of those presentations is to give an overview of different perspectives and to provide food for thought and fuel for the discussion. So once we've had those 5-minute presentations from each of the speakers, which will run back to back, is do an effective for everyone in the room. So I'll just go down the list of participants that I can see in the blue jeans screen and ask you all to just say hello and where you're from and what your interest is in this area. And we'll then go forth into the open discussion, and I'll be running that on this virtual format when we get there. So enough of me. Let's hear from the experts. We're opening with Dr. James Noble, who is a Senior Research Associate in Qualitative Research in Population Health Sciences. His research focus is on action and treatment thereof, and ties in with aspects of public health and systems. James's PhD research examined how families engage in weight management services for children with weight with findings being used to develop counter low engagements. James also worked with the Whole Systems Obesity Project team and local authorities toolkit and facilitates the adoption of a whole systems approach to obesity. So over to you, James.
Thank you very much, Lauren. Hopefully everybody can hear me okay and the internet connection is quite, it's working okay for everybody. I was going to actually start off. It's a little bit of a slightly different talk in that it's not necessarily going to be about our research as such, but more about a group that we're hoping to set up over the coming year and thereafter, which is really, again, tying in very closely with this interdisciplinary nature of bringing together multiple experts from different areas to do some more work around child and adult obesity, particularly within the west of England. So as Lauren was just briefly mentioning, I've had I've been working in sort of child and adult obesity for the last 10 years or so, and the majority of the work that I have done has been very applied in its nature. So as Lauren was saying, I'd worked sort of in the first sort of 5 years or so around weight management services, but then more recently I've kind of become more interested in systems approaches, and I was lucky enough to work as a fellow on the Public Health England Whole Systems Obesity Project, which was a 3-year piece of work led by Leeds Beckett University, and within that we worked with 11 local authorities to try and develop like a guide and a set of resources that would enable these local authorities to develop and implement a systems approach to obesity. Now, as I think most of you are all well aware that poverty and childhood obesity are very inextricably linked, and I think that's going to come through without the remainder of like the time that I have and the talk that I'm going to go through. But as I say, as we start to look at these things from more of a systems perspective, and particularly like when we start looking at the wider terms of health, we can really start to see how lots of these factors which go far beyond that of individual behaviours have quite a substantial impact on both the health of children, the health of adults, and also the likelihood of developing overweight or obesity. So the thing that I'm going to talk briefly about is something called a health integration team. I don't know if anybody is familiar with these or is part of one. I'm just sorry if I keep looking around, it's because I've got you on one screen and I'm looking at some notes on the other. But for anyone who's not familiar with the health integration team, these are organised by Bristol Health Partners. And what they aim to do is to bring together academics, practitioners, policymakers from across the west of England to try and work, I guess, better together around a topic of shared interest. And this was something that we were keen to quite develop around the idea of obesity and childhood obesity. So they also aim to accelerate the adoption of research findings and particularly try to embed these, as I say, in practice and also to help influence policy making. And partners then within these health integration teams tend to include local authorities, clinical commissioning groups, NHS trusts, voluntary community sector organisations, and the universities as well as a core. Bristol. We both started having these discussions as we knew that there was quite a limited cross-organisational and cross-sector working with regards to how we prevent and treat obesity within the west of England. And particularly our conversation was sort of situated around weight management pathways. And so we then developed this interest in actually putting forward this application for this health integration team. But what we wanted to do initially was to develop whether or not there was natural interest in this across the local area. So in sort of February of this year, we tried to bring together a real varied range of stakeholders from across all of the stakeholders that I've previously mentioned, such as your council, CCGs, NHS trusts, universities, some of which I can see are on this call as well today, which is fantastic. But what we wanted to do is to understand like what is already going on locally, but then how can we, again, as a group of people, work better as a collective to improve the prevention and treatment of child and adult obesity within the west of England. And what we wanted to do, as I say, was to identify these key areas of focus for a prospective health integration team in the future. There was, I guess, a lot of energy and engagement within this meeting. It was very clear that I think this is something that people are interested in taking forward. But I think the reason why this is so pertinent for today is because, as we said at the very beginning, poverty and childhood obesity and obesity more broadly are very inextricably linked. And I don't think it'd be really, really useful if there is an opportunity, as I say, for people such as yourselves to maybe feed into this at some point in time, given the links that there are there. Within this meeting in February time, we were able to identify, I guess, 5 key areas of focus that we might be able to work forwards with the partners as a collective. I guess the 5 of these are, and I'm going to go through these quite quickly because some of them tie in with the theme of this talk more so than others. But the first one was around the need to address weight stigma. across healthcare settings, public sector settings, and also within the public. Thanks, Lauren. It's quite difficult to see, though. You've got to look across multiple screens. So the first one, as I say, was around weight stigma. The second one was linked into the improvement of weight management pathways and practice. We know that people who live in more deprived areas are a lot less likely to access that support. And equally, if they do access that support, we know that they're much less likely to complete and receive the optimum benefits from that. So we can see that around weight management, it really ties in quite strongly with regards to some of the wider determinants of health. There's then a third theme around the evaluation of health optimization policies. That's not one that I know too much about. The fourth one was around the use of big data to try and predict some health outcomes and also to improve the evaluation of services. And then the final one, which I think is really quite pertinent to the conversations today, was around the implementation and evaluation of systems approaches. This was something that a lot of council colleagues talked quite strongly about, and particularly, and it's nice to see that Grace is on the call as well today, because Grace and some of her colleagues from Bristol City Council, they really highlighted the need to try and tie in any work such as this with the wider agendas around food poverty and sustainable food agendas. So that's something going forward that we are quite keen on linking it in with. And all of that is really, there was a Lancet Commission out last year which talked about the global syndemic of obesity, undernutrition and climate change, and the need to work collectively around all of those three topics together and drawing on some common levers across all of them. So just to close it, we have put this application in. We haven't heard back yet as to whether or not we will be successful, but fingers crossed for that. But I guess just if anybody is interested in maybe bringing some of your knowledge and your expertise into that as a health integration team, please feel free to get in touch because, yeah, it's very much an interdisciplinary topic which can very much benefit from the knowledge of us as a collection of interested parties. So that's it. Thank you.
Great, thank you very much, James. That's really interesting. And if anyone does want to get in touch to discuss that further with you, I will be circulating a post-event summary, which has got the names of attendees and a brief overview. So we'll be sharing that follow-up with some people in the room today, which would be great because obviously it's good to have these webinars to just learn about different things, but really it's even better when there are positive outcomes and enhanced networks that come out of it. So our next speaker is Maria Jesus Vega Sala, who is a PhD researcher in the Centre for Exercise, Nutrition and Health Science, which is in the School for Policy Studies at the university. Maria's thesis focused on the social inequalities of the behavioural determinants of obesity, including nutrition, physical activity and sedentarism in Chile, and this builds on her previous work on weight stigma, bullying and obesity in Chilean youth. Over to you, Maria. I think you might still be on mute, Maria. Looks like. I'm afraid we can't hear you.
No?
Can you hear me? Oh, yeah, we can hear you now.
Yeah, perfect. Sorry about that.
No problem.
So thank you so much for the introduction and many thanks for this invitation. So today I'm going to talk about my PhD research on social inequalities, specifically about obesity rates in Chile, with a special focus on childhood obesity. But firstly, a bit of background about Chile. We had a very rapid economic development that has been linked to a speedy decrease in the poverty figures and also a short and fast epidemiological and nutritional transition. In the 1990s, for example, we had 40% of the population classified as poor by an income threshold, whereas in the latest measurement in 2017, this figure decreased to nearly 9%. Nowadays, Chile is considered a high-income country, but at the same time is considered to be one of the most unequal countries in terms of income distribution. The nutritional transition was characterized by this rapid decrease of undernutrition to a very rapid increase on the obesity rates in about 30-year period. Today, Chile mainly struggles with high obesity rates among children and adults, and undernutrition, it's almost considered to be eradicated. We have one of the highest childhood obesity rates among the region and among the OECD groups, with 1 out of 4 children aged 6 and 1 out of 3 aged 10 living with obesity. My PhD research is focused on the inequalities related to obesity among the Chilean population, not specifically only on children and adults. But today I will focus on 2 systematic reviews assessing socioeconomic inequalities in the dietary behavior on the one hand and physical activity and sedentary behavior on the other. We did a comparison between the lower and the highest socioeconomic groups, assessed either by individual or household levels indicators based on education, occupation, income, or multidimensional indexes. So therefore, we are not studying specifically the population under the poverty level, but we expect this group will be included in the lowest socioeconomic group. Our first review about dietary inequalities found 8 out of 21 studies, including data from children. Among these studies, most of them assessed dietary intakes with food diaries completed either by the children or their carers. Results showed no major differences in energy intake among children from the higher and the lower socioeconomic groups. However, we found moderate but consistent associations for a lower protein, lower fat, lower dairy intake among the lower socioeconomic position children. Also, we found a higher consumption of sugar sweetened beverages among the lower socioeconomic children. Regarding physical activity, we didn't find any study among children assessing physical activity as duration, intensity, or domain, and therefore we didn't include information about children and physical activity. However, in terms of sedentary behavior, we did found an association between higher television watching among younger children from the lower socioeconomic groups and an inverse association among adolescents. Therefore, a higher television watching among the higher socioeconomic group children. Physical activity in Chile has been mainly studied throughout physical fitness, as these attributes that people have or skills they have to achieve certain exercises. And that has, in a large national study in children aged 13, has showed that despite, thank you, Lauren. Despite most of the children need to improve their physical fitness, it was the children from the lower socioeconomic groups who presented a lower physical fitness performance compared to the children from the higher socioeconomic groups. Then, like very large and overall conclusions, we have children from the lower socioeconomic groups that are more exposed to unhealthy diets, have more sedentary behavior, and in this case, worse physical fitness that contribute to the social gradients in childhood obesities. Lots talk about policies, but mainly we need policies to modify these environments where the children live, play, study, and grow to reduce these social inequalities in childhood obesity. Thank you.
Great, thank you, Maria. That was really, really interesting. And obviously, if anyone's got any questions, do make a note of them, and then they can raise them when we get to the open discussion. Same for all of our presenters today. So moving on to our third speaker, who is Professor Stephanie von Hinke from the Department of Management. Stephanie's main research interests are in health economics and applied microeconometrics. Apologies for my poor pronunciation of that, it's quite a long word. Her research covers 2 main areas. First, she's interested in the economics of obesity, diet and nutrition, looking at both potential causes and consequences of the recent rise in body weight, as well as evaluating ways to improve dietary choices. Secondly, she examines the use of genetic data in economics research, and that includes policy relevant applications and looking at genetic and environmental determinants of health and education. So I'll hand over to you now, Stephanie.
Thank you very much. So I thought I would sort of give an overview of some of the work within economics of obesity, rather than sort of specific to what I've done. So I think sort of more generally the economic of obesity. So I'm doing sort of obesity, nutrition, dietary choices, but more generally, I guess what it looks at is sort of both economic causes of obesity, as Lauren was just saying, as well as economic consequences. And in terms of causes, I guess what we would think of are things like, say changes in your employment, or if you suddenly get a drop in your income, how does it affect the decision that you do in terms of the food choices that you choose, or the amount of physical activity you do, etc. And that in turn obviously affect your body weight or your BMI, your obesity. So it's sort of thinking of economic causes like employment, income, education, but also, for example, peer effects. So where we think like if you're in a classroom and everyone around you is obese, does that make you more likely to be obese? So we're thinking of, and I guess a lot of the types of questions that we tend to look at in economics of obesity, actually there's a lot of overlap with what people do in social medicine, in social policy. In a lot of ways, there are many similarities. There are also some differences, which I'll come back to in a little bit. And I guess the other thing in terms of sort of economic consequences of obesity, we tend to look at again sort of income, employment, education. So is it that obese individuals, there is discrimination in the labour market? Are they less likely to be promoted? Are they less likely to get a job? Less likely to get an interview? And in turn, do they have lower incomes? There is obviously another aspect is the cost of obesity. So some of my colleagues in social medicine have been working on the effects of obesity on costs of the NHS, for example. And more generally, sort of cognitive skills, non-cognitive skills in children, in that if children are obese, maybe they are treated differently by their parents, by peers, by teachers, and that in turn can affect their performance in school, their mental health, their non-cognitive skills, and their cognitive skills. So I guess, as I said, a lot of this type of work is obviously done in other disciplines, and I think one of the main things where economics is quite different is where it's sort of focused on causal inference. So the idea is that we want to have sort of a causal effect of obesity on whatever outcome we're interested in, or of some exposure that we're interested in on obesity. And we tend to, at least in sort of applied microeconometrics, we tend to do this by looking at sort of natural experiments or sort of policy changes that may have affected one group of individuals and not another group. So you have a sort of a natural control group, if you like. There are other ways of doing this, but that's sort of, I guess that's the main thing where economics is slightly different, perhaps as in sort of than other disciplines. There are other disciplines are also doing this. I'm aware of, obviously, of in social medicine they use a lot of the genetic variants using as instrumental variables for obesity. And I've also done some work on this, but in economics, I think that's something that economists just don't really believe in so much. At least that's my experience from working in this. But I guess, and then sort of linking to poverty, specifically about this sort of topic. So I haven't really done much on poverty itself. I've got a bit of work sort of linking to the lower incomes, for example, or lower social classes, lower educated individuals. So, for example, I've done some work on Healthy Start vouchers, which are sort of vouchers that individuals, low-income families get when so they're on benefits and they get vouchers that they can only spend on fruit and veg. So we looked at the introduction of these vouchers and seeing, so we looked at the introduction of these vouchers and seeing how that affected families, the nutritional choices made by families in terms of their fruit and veg choices that they made. And another thing is another thing I've worked on is sort of specific about poverty is looking at school meals. So we have looked at, so in the 1980s, they took away school meals for a large group of individuals. The first in the 1980s, Margaret Thatcher obviously took away school milk, but she also took away school meals, or at least they made people pay for it. And as soon as families were supposed to be paying for school meals, you see a massive drop in the uptake of school meals and a really big increase in packed lunches. So what I did, I looked at that particular change and seeing how that affected, first of all, obviously, what they ate at school. Was it school meals or lunches? And then secondly, did it affect their BMI? And then later in the 1980s, they did a similar change where they basically what the policy did was to increase the price for school meals for one group of individuals who were on benefits, whereas another group of children who were on a different type of benefits were still getting school meals. So we could compare these two groups and compare their body weight over time. So we didn't actually find anything on BMI. There was not really any effect as far as we can tell from the data that we had on BMI, but that's sort of one way that I've sort of tried to sort of incorporate sort of poverty, if you like, in these analyses. But as I said, it's not one of my main focus. So thank you.
Great, thank you very much, Stephanie. It's really interesting. And I mean, one of the aims of this webinar series is to bring together people who aren't necessarily working on poverty per se, but who are doing poverty, potential poverty relevant, to see where there's opportunities for working together and collaboratively in those spaces. So it's great to hear from you and about the different elements of the health economics you've been doing. So thank you very much for that. So we were actually due to hear from Dr. Patricia Lucas next, who's a reader in child health research at the School for Policy Studies. However, unfortunately, she's unwell today and not able to join us. So just to give you a quick introduction into her area of interest, her primary research is in the reduction of inequalities in health and well-being in early childhood. So obviously it's a real shame we're not able to hear from her today, because she'd have some great insights into this discussion topic. But if you are interested in those areas, then do let me know and I can put you in touch with her after the event. So we're moving on now to our next speaker, who is Dr. Amanda Hughes, who is a Senior Research Associate in Epidemiology in Population Health Sciences. So Amanda's main area of research is in quantitative social research and epidemiology, and her skills and expertise include health inequalities, and she's written publications on the connections between housing, health and body mass index. So over to you, Amanda.
Yeah, so in a way, this is really good coming directly after Stephanie, because what I'm going to say sort of feeds into that quite well. So I'm a social epidemiologist by training, who's recently started doing more genetic methods with a view to causal inference. And that's sort of been quite interesting, reflecting on how the relationship between obesity in both children and adults and socioeconomic position rather than poverty per se, because most of the research for pragmatic reasons is done on broader measures of socioeconomic position that are easier to capture in the kind of surveys that we work with. But yeah, the perspectives of what's going on there often seem to differ quite a lot between fields and in terms of what people's assumptions are. And one thing that I found quite interesting is that when you talk to different researchers about this, often people sort of come with a view that it's either a case of economic circumstances cause obesity, or people coming to it with a view of, well, clearly obesity causes bad economic circumstances. And I guess just sort of something that I've been sort of feeling increasingly aware of in the last few years as I've done more research around BMI is that clearly both things happen, and this is an area where making this kind of false dichotomy is really unhelpful, because there's potential for feedback loops, and that's, yeah, it's sort of, I think that needs to be recognized, especially if you're interested in intergenerational effects, which is some of what our research is looking at. So if at different sort of ages, different points in the life course, you have, for example, for the reasons already mentioned about stigma, for example, if you have people of higher body weight who are adults doing less well in the labour market, but you also have kids growing up in lower income families being more likely to themselves be heavier, those are then sort of potential mechanisms for intergenerational transmission of both socioeconomic disadvantage and obesity with all of its consequences. And so for me, that's an area that's really interesting, is sort of where it gets feedback loopy and intergenerational. So the project I'm working on at the moment, with mostly Laura Howe and Neil Davies in the integrative epidemiology unit, is attempting to use these genetic causal inference methods to look at the effects of, I'm focusing on child obesity, on other outcomes which are relevant to health and sort of social economic well-being going forwards. So things like GCSE results. We've done work in the Ausbach cohort looking at how genetically instrumented body mass index in kids predicts their GCSE results when you sort of are doing what you can to take into account the usual suspects of confounders that might cause bias. And there's evidence that there is a detrimental effect. But yeah, I think for that to be meaningful and sort of policy relevant, that needs to be viewed in the context of the reverse causal pathway as well, acting at different points in the life course. So that's one thing I wanted to mention, the importance of bidirectionality. The other thing I want to mention is also the importance of underweight and nonlinearity in relationships more generally. So something that I've become quite interested in recently, and I've got finding applications under review for to hopefully look into further, is underweight in high income countries and whether there's evidence for social patterning in that. Thank you. So I've done some work in the UK household longitudinal study that I used to work for in adults, looking at some quite stark elevations in underweight among unemployed adults. And so I think an important area of research going forwards is looking at if there are correlates of that in children with economic disadvantage, especially in the context of recent changes to welfare policy in the last decade, because that's not been looked at. How many seconds do I have left? And basically sorry.
Yeah, that's plenty to there.
Cool.
So.
All right. Yeah, and just this is maybe like a boring statistical point, but if you're dealing with a nonlinear relationship and you don't recognize that and you use linear methods, you not only don't pick up something interesting that might be going on with underweight, you also get, underestimate the effect of stuff going on at the top end of the range because they balance out. So that's just a personal bugbear. If stuff's not linear, then you need to recognize that.
Great, thank you. That was really, really. And obviously, if there are any points you didn't have a chance to get to, you're very welcome to speak up in the open discussion and raise any issues or any questions maybe to the room of perspectives on different things. Well, so that was really interesting. Thank you, Amanda. So moving on to the first of our two external guest speakers, which is Mr. Maurice De Rosso. So Maurice is the director of the charity Feeding Bristol, who are working to improve provision for those with immediate needs and increase the local community's food skills, increase the food supply of good quality produce, and to work for policy change that will help to see a zero hunger in Bristol. So it's a fantastic cause and one with several interlinked challenges, I'm sure. So it'll be really interesting to hear more from Maurice. So over to you, Maurice.
Hello, just to check you can hear and see me okay?
Can hear you right now, but
see if the video pops up in a minute. We're going to crack on so we don't waste too much time. That's all right.
Yeah, no worries.
Good. Firstly, thanks for having me, and good to see some familiar faces as well as a whole bunch of different faces, because it's always nice to talk to different people as well as the people you know. As Lauren said, I'm director of this charity, Feeding Bristol. You may have heard of us. We're only a couple of years old. Our vision really doesn't have poverty or insecurity or equality in the vision title, and that was something we actively changed earlier this year, partly because we wanted to just be more encompassing. So our vision being that everyone in Bristol should have access to nutritious and affordable food, and that they have the skills, knowledge, and that they're empowered to eat healthily. So you can see there already it's covering off a huge scope of work. And I should probably throw in there that we're a tiny team. So at the moment, we're about 1.5 FTE in the core team, and we'll be going to 2 FTE come the end of this year. So the way we work is probably the more important part, and that's really being collaborative across the city. We focus on providing strategic support to the numerous community organisations and other platforms out there where people are already working on this kind of stuff. But often it's hard when you're in the grassroots side of things to pull yourself out of it and to look at the bigger picture. So what we look to do is galvanise all these groups and provide a bit more strategic oversight. What that allows us to do then as well, Lauren mentioned that policy side, so the whole systemic change, root causes. To be frank, we haven't done much of that to date. We're only a couple of years old. We've done a lot of more of that immediate need support, so tackling holiday hunger, really tackling that level of issue. And I suppose what we're building and what we've built is this infrastructure where we can have a bottom-up to top-down approach. So as the next chapter of Feeding Bristol moves forward, we can really look into what are the root causes in specific communities across Bristol. We have 91 different languages spoken across Bristol. There is no silver bullet in tackling any kind of food inequalities. Every little corner of Bristol is going to have a different way of tackling it. But in saying that, we know we can't get much done. You're not going to get much bang for your buck unless you have economies of scale. That's where we come in. We take the advice from the bottom up, and we try to support them and complement their services by providing some top-down approach. It also means we can gather evidence, we can feed into national level organisations. So we're part of the Feeding Britain network. We liaise with Family Action, a whole bunch of other national guys, where we can say, okay, we've got this little Bristol thing going on, and we can focus on making things effective here. But for that real long-term change, there's got to be policy reform. There's got to be other elements like that we tackle, and so we're part of that picture. I could keep talking for way too long, so I just want to rattle off a couple of the pieces of work that we're looking at to date, just to kind of give you a bit of an oversight of how we're tackling the solution, tackling the issue. I've got to mention COVID. I don't think it's really come up that much yet. Feeding Bristol's been working with some other leaders across the city, so Council, Fair Share, Bristol Food Network, and we've been providing that strategic oversight in supporting the economically vulnerable with their food needs across the city, specifically targeting the vulnerable areas of Bristol. What's important to note, though, is that across all this time, social distancing has meant any kind of other community level work, social dynamics, all the health and well-being elements of these pieces of work have gone out the window. Everything's turned into giving out food parcels or some element of free food. Now that's been great as the issue's been getting worse, but what the common thread that's occurring, and I'm really glad, thanks Lauren, I'm really glad it's going down this route, is we've got to look at the bigger picture. And we've got to track away from the free food aspect so that we can provide financially sustainable projects across the city that mean you're providing continuity of service to those who need it, and you're not creating dependence. And so we're in this real sensitive time frame now where we need to be careful to not just crack on with the free food model. So we don't have the answer yet in how we're doing that, but we're working with the council on a food equality action plan where we're still working at a national level on these kind of issues. So sorry, I will just quickly jump. It is not a good way to transition, but healthy holidays, holiday hunger. I really wanted to throw this one in just to finish off, because while on one hand we've got the COVID issue, we've been giving out a whole bunch of free food. On the other hand, you've got 14,000 kids in Bristol eligible for free school meals. Take into consideration that's not even all the vulnerable children and families. So now we've got to look at how do we support all these kids from their entire health and well-being. And this isn't, when I say we, this is the city. This isn't just Feeding Bristol. And the thing that we're looking at now is going, there is so much food out there. We've kind of ticked that box. We've got to rely and trust that that's working. How do we focus on the rest of the health and well-being, the way people buy their food, what they're choosing to eat, what activities they can do, so what parcels can they take home, their activity and resource packs. It's a whole different ballgame, but we are very cautious and wary that if we don't do it right, then the long-term impacts of the free food that's been increased through COVID and the way that these children are being influenced through the lack of school time and all these kind of things, it's going to have some serious long-term impacts. So that's what we're tackling at the moment, and I'll stop talking now. So thank you very much.
Great, thank you, Maurice. That was really, really interesting to hear a different perspective on it, and actually links quite well to our final speaker, who's from Bristol City Council. Just before I forget, I just wanted to flag, I don't know if you're in touch with Jumpstart, but it might be worth speaking to them, because she's running classes or been running fitness classes for underprivileged children in Bristol to work on kind of the mental and physical health. So yeah, I can put you in touch if that's helpful.
Yeah, get us in touch. That'd be great. Thanks.
Yeah, no worries. So finally, as I mentioned, we're going to hear from a member of Bristol City Council. So we've got Dr. Georgie MacArthur. So she is representing Bristol City Council here today, but she is also an honorary lecturer in population health at the university. So Georgie is here alongside her colleague Grace Davis, who's also available in the open discussion portion, but Georgie's the one presenting. So Georgie is a specialty registrar in public health for the council, and is here to speak to us today about the council's whole system approach to healthy weight in Bristol, which has reducing food poverty as one of the strands of work. And in particular, Georgie has been leading on the Eating Better element of that project, which is clearly relevant to our topic here today and linked into some things Maurice was talking about. So looking forward to hearing about that. And we'll hand over to you now, Georgie. I think you're on mute still, Georgie.
So sorry. Can everybody hear me now?
Yes.
Okay, yeah. Good morning, everybody. Just to say, it's really good to see you, and thank you very much for inviting us, Lauren. As Lauren mentioned, I'm a specialty registrar in public health, and I work in the public health team with Grace Davies and also Sally Hogg, who's consultant in public health. And I have a joint post with the university, so I'm really interested in the links between practice and research and how they can inform each other. But really just to sort of highlight today our work at the local authority and how it's focused on implementing a whole system approach. So this is something that James touched on earlier. And that whole system approach aims to address the childhood obesity and food poverty, which are inextricably linked, and addressing both outcomes essentially means we can address both together. And it really just takes into account that no single intervention can do that, and there's no linear cause-effect model. So if we can shift multiple parts of the system and influence the range of wider determinants of these issues, then we can have a greater impact. So we're using the Public Health England guidance to underpin our approach, but working across kind of employment, businesses, city design, schools and the environment there, public transport, and working with a range of colleagues across the council and across the city. I don't know how familiar the group are with the kind of one city plan and the one city approach, but many of the outcomes we're working towards, such as reducing the overall prevalence of childhood obesity and reducing the inequality in childhood obesity, are outlined in that one city plan as key ambitions for the city. And you'll be familiar with the data around the prevalence of childhood overweight and obesity being twice as high in the most deprived compared to the least deprived areas. And so addressing those outcomes and being in the one city plan and our one city approach are really critical. And so we're working across the council with colleagues in education, work in employment. We work with Feeding Bristol, you just heard from Maurice, and parks, leisure centres, addressing physical activity, and also working with our colleagues in mental health. And Grace has done a lot of work with food businesses and the food offer, as well as sort of procurement, and I've focused more on the sort of eating better side of things. So part of my work has been, how can we encourage people to cook more from scratch? How can we improve access to healthy and nutritious foods? One of the specific areas of work we've implemented with a sort of consortium of partners from across the city, including Feeding Bristol and some leaders from the culinary industry and charity and community groups, has been a pilot programme for how can we, which will be affected by COVID, but in the future we're hoping to pilot this, but training people in communities to develop the skills to cook from scratch, but also to then teach others and provide support and mentoring to enable people to do that. And also engaging with communities to understand some of the strengths we can build on, what are the priorities locally. We're also developing a food equality strategy for the city, and that will take into account the kind of how can we have a sustainable response following on from COVID, and how can we bring this systems approach and all the partners together. I suppose the last thing to say really is just how we can link with the university, and we're really keen to hear perspectives from yourselves and to work with researchers to understand not only just food poverty and its relationship with overweight and obesity, but also the impact of some of the interventions we'll be implementing in that kind of wider system response. So please do get in touch if you have ideas and thoughts about that. And my colleague Grace might want to add to that, but that's basically a nutshell about what we're hoping to implement and what we're doing at the moment.
Great, thank you very much, Georgie. We do have just over a minute left on your time. If Grace wanted to say anything now, or we can go into the open discussion if that's better.
I think, Georgie, you covered that very well. I think probably best use of the questions, and I can answer things then. Is that okay?
Yeah, no, that's absolutely fine, no problem at all. So in that case, I just want to say thank you again to all of our speakers. Been a really good range of discussions, and actually lots of areas where people are talking about similar things where they might be able to take forward those discussions and collaborations, which is fantastic. So before I'm going to open up the floor to questions, I'll just do a kind of roundtable format. So what I'm going to do is I'm just going to go down the list of people who are here and just call on you to just say who you are and your background. Then we'll move on to the discussion. So if you can just, in the discussion, if you can just type your name in the chat window, and then I'll come to you in order to raise your question. So first person on the list is Agnes Nairn. Do you want to just say hello, Agnes?
Hi, I'm Agnes Nairn. I'm Professor of Marketing in the School of Management, and I've done a lot of work on the relationship of marketing of high salt, sugar and fat foods and obesity. And when we come on to the discussion, I'd like to add a little bit about some of the work that's been done in that area. Thank you.
Great, thank you, Agnes. Next, we've got Alan Emond.
Morning. My name is Alan Emond. I'm Emeritus Professor of Child Health at Bristol Medical School. I'm an academic paediatrician, and although I'm retired from clinical work, I'm still research active. And I've been interested in the problem of inequality and obesity, both as a clinician and as a researcher using ALSPAC.
Thank you, Alan. Next, we've got David Gordon.
I'm David Gordon. I'm director of the Bristol Poverty Institute. I have a long-term interest of working with UNICEF and colleagues such as Shoylin Nandi at the University of Cardiff in looking at child malnutrition, but also the double burden of malnutrition of children and adults who are stunted and obese or overweight. I'm currently working with colleagues at McGill on using the Food Insecurity Experience Index to look at malnutrition and hunger in adolescents and mental health outcomes, and to a certain extent physical health outcomes.
Okay, thank you. Next we've got, we had a couple of speakers. So then Jennifer Cox is the next one on the list here.
Hi there, I'm a PhD student looking at interventions for the Childhood Obesity Clinic that Julian heads up. I'm sure he'll tell you a bit more about it when he gets to.
Okay, great. So we've got Jessica Paddock next.
Hi, I'm Jessica Paddock. I'm a sociologist with an interest in practices, understanding patterns of food and eating within a kind of a social cultural context. That's all I'll say for now. I don't really do any research on obesity, but I have an interest in inequality, and obesity tends to intersect with some of the work that I do rather than being a focus of it.
Yeah, Great. That's what these webinars are for, is for people who've, bringing together people who've got connections and intersections. So that's great. And so we've got Julian Hamilton-Shield next.
So I put my microphone on. I work at the Children's Hospital in Bristol, and I'm a professor of diabetes and metabolic endocrinology. But I work with children. I run an obesity clinic. I also work in the BRC nutrition theme, where one of our major streams is chronic disease in children, and obesity is one of the things we research. We look at things like changing people's behaviour towards eating, how people eat. We've actually tried to run a cooking from scratch intervention in Bristol a couple of years back, and we've done other sorts of interventions in the community as well, to lesser or greater effect. So I'm interested in all sorts of things, but I actually run an obesity clinic. I run a children's obesity clinic for children with very morbid obesity, and I sit on the advisory committee for NHS England on childhood obesity.
Oh wow, great. It'll be really, really interesting to hear a bit more about that when we move to the open discussion. Excuse me. So next person to introduce is Lindsay Pike.
Hi, my name's Lindsay. So I have two part-time roles, one at Policy Bristol and one in the integrative epidemiology unit, which is where Amanda Hughes works as well. And both of those roles are around creating connections between researchers and policymakers, so we can make sure that the policies made are based on the best evidence base.
Fantastic, thank you, Lindsay. So the next person is Mark Haler.
Fine, my name is Mark Haler. I've recently returned from Hong Kong after 35 years there as a professor in public policy and management at City University. My interest in poverty and obesity is really from the poorest of the poor district in Hong Kong, Sham Shui Po, and I worked on a project called The Hub, which tried to bring the children who are mostly living in bed spaces or subdivided flats, many of whom were stunted or obese. It seemed to be one or the other, but not very many in the middle. And we were running an organisation that tried to educate particularly the mothers, to give the children space to go and work and network and be coached for homework, but also food was very important. Slowly we built up a kitchen for the mothers to learn how to cook. We provided fruit for the children to try and improve their diet, and a number of other sort of activities. But that idea has spread quite widely across Hong Kong now. And I'm interested to know about Bristol and what is happening here now that I live here.
Okay, thank you, Mark. So next we've got Pip Clary.
Hi, I'm an academic foundation doctor working at the Centre for Academic Child Health. My interests are more broad and just about the wider determinants of health in childhood, mostly looking at obesity, but also mental health outcomes.
Next we've got Sarah Torcelli-Turan.
Hi, my name is Sarah, and I'm a researcher at the NIHR Bristol Biomedical Research Centre, so I work with Julian and Jen. I specifically look at cost-effective interventions for weight management, so how to improve physical activity and dietary behaviour. And I'm particularly interested at the moment in overcoming the digital barrier to accessing health, primarily because that's where the NHS is moving towards.
Thank you. And our final introduction is from Shailen Nandi.
Hi. Yes, I'm Shailen. I'm currently at Cardiff University. I've been lucky enough to work with Dave and colleagues at the Poverty Institute and Townsend Poverty Centre for many years, focusing on developing countries or low and middle income countries and the use of household survey data to look at changes over time, particularly amongst the issues of poverty and inequality, but more recently on obesity in Peru, working with some very good colleagues at the Chronicas Research Center at Cayetano University there. So this is very interesting for me.
Great, thank you very much, everybody. So, as I mentioned, if you've got a question or comments, if you could just type your name or me or some small note in the chat window, then I'll call on you and let you unmute the microphone and ask your questions yourselves. So firstly, do we have any questions or comments following the presentations, questions for the speakers, or anything you want to follow up on that? Okay, so nothing's come through yet on that. So I might hand over then to Agnes, because you mentioned you had some things you wanted to raise in the group discussion.
Yeah, sure. Thanks very much. This is really, really interesting. And actually, there are some issues that both Stephanie, Maria and Georgie brought up that might be interesting. So I work in marketing. Marketing is a huge area, but there's probably 6 areas that are particularly relevant to poverty and obesity, I think. I mean, marketing 101, there's product, price, place, promotion. So in terms of the products being produced, so Maria mentioned that high, sugary drinks were more predominantly drunk by children in the lower socioeconomic groups. So I suppose marketing research has led to things like the sugar tax. So in some countries, there's now a sugar tax that means that products that are very high in sugar are taxed so that they become more expensive and therefore less attractive. And it also means that manufacturers are encouraged to make their products more healthy. So that's sort of on the product side. On the place side, things like not having chocolates at the checkout is something that marketing research feeds into, and a lot of big supermarkets have signed up to not having chocolates and sweets at the checkout because that stops impulse purchasing of those things. Promotion is probably one of the biggest ones, and a lot of the work I do is on the regulation of advertising of harmful products like high salt, sugar and fat foods. And I did work, thinking about Maria's work again, with the Brazilian government, who've had a very, very similar, going from people starving to people with an obesity crisis in the space of 10 years. And they've actually made advertising to children completely illegal because they think it has a detrimental effect. And we do know that children from lower socioeconomic groups watch a lot more TV because it's really cheap. So they're not out doing music lessons and gym lessons and everything else because they're expensive. So they are exposed to a lot more TV adverts. We also know they watch a lot more commercial TV, which means that these branded products are being bombarded at them. And the branded products tend not to be very healthy, but they also tend to be incredibly attractive because they're branded, so they're cool. So, thinking about something, I think it was Stephanie was talking about lunchbox analysis. There's a lot of work in marketing being done. Kids want to have the right products in their lunchboxes so that they can fit in. And so, we've tried to do some work to mean that unhealthy products can't have, characters like Tony the Tiger on Frosties that make things super attractive to kids. So that's the
Oh, I think you've just frozen, Agnes. Lost you, I think, there for a second. See if you can come back, and if not, we'll come back to you when your connection's back up.
Is that back?
Yes. Yeah.
Sorry, I was just talking about social marketing. We are working with the Bristol City Council already on some of our student marketing programs, looking at how you can use the communication techniques that marketers use to sell things, to sell the idea of a healthy lifestyle. And a lot of social marketing work has been done around the area of food choice. So yeah, I just wanted to and we're very happy if anyone's interested in adding this to their interdisciplinary studies. We're very, very happy to meet with anyone on any of these amazing projects, if it's of interest. Thank you.
Thank you, Agnes. Does anyone have any comments or thoughts on the issues Agnes raised there around marketing and how that can link to obesity and poverty dimensions of that? Yeah, I see Grace Davis has got a hand up there, so I'll let you speak. Just to flag, generally speaking, it's better to put it in the chat because I can only see 9 videos at a time. So sort of if you put your hand up, I might not be able to see if you're not one of the blue jeans has chosen to let me see it at that moment. But so we've got Grace Davies, and then I think Shailen wanted to say something on that as well. So we'll go to him next.
Thank you, Lauren and Agnes. When you were speaking, Agnes, I was thinking very much of the programme we're trying to run in Bristol. You may have heard of Bristol Eating Better. This is really about how we're trying to change the food environment. This is thinking about the restaurants, cafes that actually aren't largely open at the moment, so it's not quite so relevant in this current climate. But the idea there is to address the things like promotion and place of products, reducing the amount of high fat, salt, sugar products. There's a whole range of commitments that businesses take on and they get the award. We've actually got 150 businesses in Bristol signed up to that, and we've been using that. Obviously, things have changed because we're having to work more with supporting businesses to open. But again, there's opportunity to, as they open, to look again at the products and supporting healthier diets and encouraging new places, places to reshape really how they do things. So very much those things you're talking about, we want to embrace as part of changing our food environment. That was really what I wanted to say initially.
Thank you, Grace. And Shailen, I think you had something to say, although I think it's a question for Agnes, who seems to have been disconnected briefly. So I don't know if you still want to kind of pose it to the room. Oh no, she's back. She's back. So go ahead.
Well, thank you, Lauren. I mean, it was interesting to see. Sorry, it was great to see a professor of marketing on here, because some of the questions that emerged from the work that we've done in Peru recently. We were at a workshop there in January where someone made the point that we seem to be following the way tobacco went for sort of 40 or 50 years in terms of the evidence behind a clearly damaging product being continually promoted over time and undermining efforts to tackle the issue. There was a World Bank report from the mid-2000s, I think, that estimated marketing spend from the food industry at about $40 billion a year. Now, if you've got health education budgets in many countries that are a fraction of that, we're forever going to be playing catch up with that. So if there's anyone who knows of sort of research on the interaction between budgeting for food marketing of frankly unhealthy stuff, in the example of Peru, it's not a case of just the McDonald's or the KFCs or the soft and carbonated drinks that are going out. It's the high processed, it's the ultra processed foods that are going into small and medium sized supermarkets that are now the main providers of food in many of the neighborhoods, but also particularly in rural areas as well. And what we observed with regards to obesity was a higher rate of increase amongst the rural non-poor than amongst the urban poor. I mean, the rural non-poor are probably still poorer than the urban non-poor, but when we saw the rates of increase occurring, it was in this population at the fastest rate than in other populations. And part of the reason was because these groups were the first to be able to access the ultra-processed goods and foods in the supermarkets and in the small and medium-sized supermarkets in the rural areas as well. So the marketing element and the more structural focus and things like obesogenic environments, I think, are a much bigger part of the story that many of our analyses tend to miss. So it's really interesting to see the marketing element on here. It's very useful. Thank you.
Does anyone else have any follow-up comments to Agnes's points or anything that's come from Shailen or Grace since before we move on to the next question?
Sorry, Lauren, can I comment something?
Yep, go ahead, Maria.
Thank you. Yes, it's very interesting what Agnes was mentioning. Several of those policies have been implemented in Chile so far. We have nowadays the higher obesity rate for adults around the OECD group. So a lot of policies have been implemented. The sugar tax was implemented in 2014. And now some preliminary studies have suggested that the reduction in sugar and sweetened beverages due to the sugar tax has impacted more the higher socioeconomic groups rather than the lowest socioeconomic groups. So it has like these unintended consequences in terms of, this is all based on food purchases at household level. We don't know actually about the intake, but they are highly correlated. We have implemented the banning the cartoons on cereal boxes high in sugar and fat and sodium. Those policies haven't been studied so far much because, well, they were implemented in 2018. So it's quite soon to have a kind of a conclusive saying about that. But in terms of the sugar sweetened beverage tax, it's being like kind of controversial on who's kind of having a larger effect on.
Thank you. And I think Julian wanted to come in to comment on marketing in Cameroon, building on comments around Peru made earlier.
Yes, I work with a group in the Cameroon who've been looking at non-communicable diseases in urban compared to rural areas in the Cameroon, and exactly the same things happening. So the urban, not so poor people are very much directed towards westernized food, and that's where the increase in obesity and diabetes is happening rather than in the rural areas. And it seems to be a facet of becoming urbanized and having some income and being subject to the marketing you see in city areas. And I think they sort of seen the same in India as well. But I think that's universal across most developing countries, actually, is that the people getting the problems with their obesity are those who have a little bit more money, but they live in towns and they actually have access to these sorts of facilities, such as, I wouldn't just decry McDonald's, but all of these. And Cameroon has its own McDonald's, which is even more energy dense, in fact. And that's...
Yeah, that's really interesting. Thank you. So just the next question now. If anyone has anything else to follow up, then do let me know. So right at the start, Stephanie had a hand raised. So I don't know if you wanted to go ahead, Stephanie.
Sorry, I was just this was it. So basically in response to one of these speakers, Amanda. I just wanted to know sort of if you could, do you have any idea of how important this undernutrition is? Because obviously we're all talking about obesity, and I know it's important, but I just out of interest, really, I thought it'd be interesting to know how important this is in the UK, because you could think of, obviously in poverty, people, they might not have sufficient money to actually buy enough food, and therefore lead to undernutrition. Whereas on the other side, they might buy the wrong type of food, which leads to overnutrition. So I was just wondering whether, if you have any stats on these, just for my own interest.
Yeah, for sure. So the first thing to say is, it's certainly in sort of absolute prevalence terms a much smaller problem than overweight and obesity. By a long way. So it's a couple of percent, but I think it's a small group, but and also there's been very little that's been done on this. So I found one paper by, I think, Anna Pierce and colleagues using the National Child Measurement Programme and also the Millennium Cohort Study, looking at inequalities in child underweight. And they were getting sort of odds ratios of 1.5 between the socioeconomic groups. The prevalences were, I don't want to say in case it was wrong, but they weren't big, but there were inequalities there that I think, just because it's being looked at not at all, I think it needs to be looked at some just to start with.
No, I definitely agree. I think it's an interesting angle, and worth looking into.
Great. So I'm going to move on now to the next question on the list. So Alan, you wanted to ask about promoting access to fruit and vegetables in deprived areas?
Yeah, given that all our food choices are partly determined by price, and price has a big impact on healthy food choices for people living in deprived areas. So if you've got a limited budget, price is going to have a massive impact on your food choice. And I would like to ask Maurice and Georgie and others in Bristol City about intervention to improve the availability of fruit and vegetables in urban deprived areas where the cost of transport is a major factor in the price differential for small and medium-sized supermarkets where most people shop. So in the big supermarkets, the cost of transport is absorbed in massive volumes. But in the smaller supermarkets, price is a big factor. And I've been involved in the past with projects where we've specifically subsidised the transport of fruit and vegetables from local suppliers to local shops, which is a double win situation. So you support the local supplier, but you also provide fruit and veg at a subsidised price, which makes it competitive with higher energy alternatives for people with limited budgets to help them make healthy food choices. So I wonder if this is being considered, because it has been shown in small pilot studies in the past to be effective.
Yeah, I'm happy to pick this up. You can hear me, can't you? Sorry, it's hard to tell. Yeah, cool. I suppose there's numerous ways we're looking at this, and it's definitely high on our agenda. Really simple way for us is considering the demand and supply of it. So purely saying the price of food isn't going to solve the issue. There's the cultural change side of things as well. You know, if you look at prices, we go and compare culturally to the rest of Europe. What is it? Brits on average spend 9% of their household income. You get the likes of France and Italy spending upwards to 20% of household income. That's across the board. So we know just that general demand, whether it's in disadvantaged areas or not, is a factor. So for us, I mean, we've got a couple of projects going on in Bristol. I mentioned the food clubs earlier. So that's a model. It's a financially sustainable model where surplus food from Fair Share is sold to members for £3.50 for a food hamper, and they receive about £15 to £20 retail value equivalent of food. What's really impactful though through that project is that it's not just about getting the food, it's not just the provision, it's that club element that I mentioned earlier. It's the social dynamic, the interaction that people have with that food. So to give two kind of anecdotal pieces of feedback I've heard from these areas. So this one family didn't know where the porridge was made from oats, so they were buying quick oats rather than a kilo of oats. Which, you know, all of a sudden the way they're spending the money isn't right. They didn't know that that bread could last more than a day. So any loaf they had, they'd throw out the rest after the day. So there's the educational side, and we've got to be really careful because we don't want to be patronising and saying you've got to spend your money better and you've got to eat better like I do because I was brought up yada yada yada. It's not what we do. We want to empower them to have the tools in their back pocket to make those decisions. At the same time, it's hypocritical to say that and then not look at the supply of food in that area. So that's where we're looking at how can we set up more commercially viable models that provide that continuity that I mentioned before, because we've seen all too many times projects pop up that rely on grant funding all the way through. Community gets really comfortable and really enjoys it, and then all of a sudden the grant funding runs out. So we've got to avoid that. So it's a real balance. We can't just overlay all the disadvantaged areas where there's fewer supermarkets with extra fruit and veg markets or community supermarkets. We need to do that in part in collaboration with those other community groups who are working with the disadvantaged families that understand why they aren't eating better. Is it due to the facilities in their household? They don't have access or don't understand where they can go get support for cooking facilities. They don't know that how to make a nutritionally tasty meal. Sorry, I've been talking for a while, but one last bit just to explain how we're linking up the provision versus the education side. A second project, the Children's Kitchen, which some of you might have heard of Jo Ingleby. She's a children's chef consultant. She's started this project, the Children's Kitchen, which is all about teaching early years kids, so your kind of 2 and 3 year olds in the council-run nurseries about food. It's really basic. It's really cute. You're seeing these little kids with plastic knives chopping up some red cabbage or some radishes, and they're just trying it for the first time. And all of a sudden, we aligned that to the food club. And what happened with the best example one day, this was pre-COVID, obviously. In the Children's Kitchen, the food that came from Fairshare that day, there was red cabbage. And all of a sudden, the kid who'd never seen red cabbage, where it was then provided in the food hamper through the food club later that day, and the parent responded going, what am I going to do with that red cabbage? I don't know what that is. The kid was influencing the parent and saying, oh, we used that this morning. I'll show you what to do at home. And you can see that dynamic, that they're all independent projects, but I'll stop talking because I'm rambling a bit, but for me, it's balancing the cost of the goods with the cultural change.
Thank you, Mike. That was really, really interesting. And yeah, obviously there's that really important balance, and then about the kind of knowledge trickling through, as you said, and sort of just kind of food parcels. It's about what you can do with them and learning to develop that. So I believe Dave had a question for Grace or Georgie from the council.
Bye-bye. Sorry, I just got a phone call from the hospital, but that's fine. So is it me you want me to speak? So I just had to rush out.
Oh no, I was going to ask Dave, but I believe actually your question was quite directly related to what we've just been talking about. If you don't mind waiting, Dave, if we go to Julian first.
Sure. No, please.
I think you had a question about the interventions of the eating from scratch interventions, which ties directly onto what we were just talking about there.
I am sorry, I just had to go out for a second because the hospital was phoning me. So I heard Georgie and I thought it might be. I did have a question for Georgie. I mean, what experience have you got so far of eating from scratch interventions? Because a couple of years ago, we did something with the Portland Complementary Health thing and the Square Food Foundation up in North West. It was called the Nourish Project. And we found it very, very difficult to get families to engage in, even though it was free and they took their food home after they've eaten it, we found them very difficult to engage. And we wrote a report saying it's, unless you find a different way of engaging people other than just saying, would you like to come and learn how to eat from fresh and food because it'll be much more healthy for you. We really didn't recruit anywhere near as many patients, so recruitment was a real problem. And I don't know how, if there's a better way of recruiting. I'm quite happy to send the report through to people because it was very disappointing actually. We wrote it up as being a failed intervention, which we thought would actually be very popular amongst families.
Yeah, I think that's really interesting around the engagement. So the pilot work I'm talking about hasn't started. It involves Wellspring Settlement and Square Food and others as well. And I think the plan would be to really strengthen that kind of community grassroots engagement so that it's very much kind of rooted in what communities want, very much tailored, and there's a sort of intensive engagement process first, I suppose, and also bringing members of the community in to sort of evaluate it and explore whether it's worked or not and how it could be improved. Another thing was really to focus on, and I should add, obviously this pilot hasn't started, but to focus on training people who can then teach others in communities in a way that fits with what people need and want. And so perhaps focusing on that kind of teaching side and providing that support to then teach others. So just having a slightly different stance, but I'd be really interested to see your report if you're happy to share it. I know there are some other programs in the north that have been really successful at engaging communities. So I think it's perhaps just trying to understand how best we can do that and make it really strengthen that engagement with it. But I think you're right, it's a difficult thing. And I'd be really glad to hear more about your work.
Yeah, no, I'm very happy. We wrote it up as a paper, but Ava Loring, who's worked with me a few times, wrote a very good report, and I'm very happy to share it with you. It's difficult, much more difficult than you think, and the hook to get people in is, I don't know what the hook is. If you can find a hook, it's really good, because we certainly weren't able to do it.
I've been following on from Julian's intervention that he was just discussing. I've been doing some work with Square Food Foundation, and they've been running a program embedded within a primary school. So they've taken a sort of much more whole school approach, and the interventions sort of come from inside the school. It's run by Square Food, but that's had a slightly better recruitment rate and retention rate, because it's sort of within a system that the families already know and trust. So it's slightly better than the first attempt.
It's Maurice again. Can I add one little thing as well? One thing we've noticed through the food clubs is how well people respond when there is a fee. It removes the stigma of being completely free, and that, to some extent it helps with the financial management as well. And there was a young girl, single mother, 18 or something, who was really enjoying the learning of balancing that £3.50 and just not receiving something for free. So something to note as well.
Yeah, I think this school were thinking they're also using that program, and I think that they were trying to get the teachers to buy into the program as well, so it looked like a completely inclusive program rather than it being a handout, because there were lots of families who were some of the most at need, who weren't accessing any of the resources through not wanting to sort of put their hand up and say they were struggling. Definitely important.
Right.
Thank you very much. That's all really interesting discussions there. So we were moving to Dave had the next question, I believe, for Bristol City Council.
Yes, I just wanted to ask about the kind of medium-term to long-term planning of the impact of COVID-19 on the nutrition particularly of children in Bristol. The UK government seems to have little interest in nutrition during the Second World War. Arguably, the rationing system led to an improvement in the nutrition of adults and children, but the experience of the emergency food boxes delivered to the most vulnerable seems to be that there were no nutritional requirements. It was left to the industry or whoever was delivering them on the content, more or less, and Public Health England and DEFRA kept passing the buck to each other when asked who was meant to be overseeing this. Their projections that there's going to be a large increase in poverty, and particularly child poverty in Bristol, and also that a lot of the fresh fruit and vegetables we've been getting during the pandemic have been coming from Europe, and there may be problems with supply after Brexit is finalised at the end of this year. If that coincides with a second wave of the pandemic, you could have a perfect storm of increasing food insecurity, increasing poverty, increasing costs of fresh fruit and vegetables. And I just wondered if there were any plans to deal with this potential problem.
Grace, you may be better placed to highlight the response than myself.
Yes, thank you, David, for that question. There's a number of things in response to that. Ever since the COVID crisis started, a group of partners has been meeting regularly. Maurice is one of them. Georgie's come in at a later stage, but it's made up of some key people within the council, and then there's others, including Bristol Food Network, Bristol Food Producers, and then we've got our consultants in public health that are coming in and advising as well. And it's really just to be a platform to raise all the issues potentially ahead of us, including the potential for a second wave, including potential increases in obesity and healthy weight and food poverty. And bit by bit, we're going through some of the ways that we can deal with them. So Patricia, who's not here today, has got involved as well, looking at how we look ahead to nutrition, and you've mentioned this is a real issue. So I think some research is being developed there around what's happened during these last few months and what could happen going forward. Certainly from my perspective, working within public health with partners, it's been a fantastic way of not necessarily being able to have all the answers, but to have the right people there to discuss how we work with this. I've done a lot of work recently with food businesses because we have, any number of crises going on amongst the food business sector, and so trying to engage with them by means of this sort of platform and webinars has been really useful, and we're trying to bring into that the underlying nutrition, because we're talking about feeding our city and our most vulnerable, and we need to have the food accessibility. So that's a very long-winded answer, but just to say, if you want more specific information, David, I'm very happy to give you some more examples of specific pieces of work, and same with Georgie could as well. But I'd probably better not talk anymore as it's 12:28.
Great, thank you very much, Grace. And as you say, we are getting right to the end of it. So apologies, I know Mark had a question, but perhaps if you could send me that a quick email, Mark, with who that was targeted at, and I can then put that in touch. Because I'm mindful that people have got other meetings at 12:30 they need to get to. So I think we need to start wrapping up now, unfortunately. But I just want to say again, thank you very much to everybody for all of the speakers in particular, but also for everybody else being such active participants in the discussion and bringing up such important issues and exploring the different ways that they can be tackled, but also sharing learning of where you've already perhaps tried something that hasn't worked out the way you might hope it would. So it's been really, really engaging. We will be writing up a summary. My colleague Sarah has been taking notes throughout this, so thank you also to her for doing a great job with that. Because particularly on a webinar format, it's difficult to keep up with everything. But we will be circulating that summary. We have recorded it, so technical issues allowing, we will be sure. So if you dropped out, your connection dropped out for a bit or something, and you want to listen back to it, you're very welcome. Or if you want to share on that recording, it'll be on our website if we can manage to get that sorted. So you're very welcome to share that with other colleagues or contacts who you think might be interested in the things we've been talking about today. And do get in touch with us at the Poverty Institute if there's anything you want to discuss, any connections you want us to help you with, any bids you're looking to develop, or publications coming out of things that we've talked about today, and seeing how we can take these forward and really hopefully have a positive impact on childhood obesity levels and obviously poverty as well through the discussions that have come out of today. So I'm just going to pop up a slide here which has got our contact details if you want to get in touch again, or obviously you've all got my email because I was in touch with all of you about registering. So yeah, thank you again, and do keep in touch, and hopefully we'll be able to take this forward. So thank you for joining, and we'll see you all soon, hopefully.
Thanks all.